Great. Good morning, everyone. I think we're going to get started this morning. So thank you all for coming to our fourth Office of Traffic Safety Peer Exchange session. My name is Amy Zoe, and I'm a junior planner for public health and transportation safety at SCAG. So thank you all for joining us today at the Traffic Safety Peer Exchange series. I'll be facilitating today's session along with Clay Barnes from Cambridge Systematics, who was one of our consultants supporting this project. At the time, we'd like to encourage you to type your name, your pronouns, and your organization into the chat feature, and this will help us know who's in the room, and will also help us ensure that the function is working for you. Just a note as well, you should have gotten a notification, but today's session will also be recorded and screenshotted. So if you have an issue with this, or if there are any problems, please let us know. You can contact me directly in the chat, or you can mention something in the chat. Next slide, please. So this peer exchange is anticipated to run for an hour and a half. And right now, all participant lines should be muted. At the end of the presentation, there will be a Q&A. And if you have a question during the presentation, please type it into the chat box below. Or you can raise your hand and we'll call on you later to unmute yourself. If you think of something later, you can reach out either to the presenters or to the program manager, Courtney Aguirre, whose email is on the screen. And all presentations will be emailed to those who registered to participate in today's meeting. Today's peer exchange will also include presentations focused on on the intersections of public health and transportation safety before we have an engaging fishbowl or Zoom bowl in today's age conversation among our guest speakers. And to wrap up, we'll have breakout sessions where you can chat more directly with today's speakers as well as each other and debrief on what you've learned. Next slide, please. Today's presentations are going to be a quick overview, are going to be as follows, as you can see on the screen. There's going to be a quick overview of the regional conditions and the Go Human campaign, followed by a presentation on the new normal resolution, confronting systemic racism and inequities through prevention. Thirdly, we're going to have Vision Zero in LA County with cross-sector collaboration to save lives. And fourth is going to be the significance of partnerships. Next slide. So we're just going to start really briefly with some background with you on our region's existing conditions and to provide some context on why we're holding these traffic safety peer exchanges. I wanted to also share a little bit more regarding our Go Human education and encouragement campaign and resources that are available to you as you work to reduce fatalities and serious injuries in your communities. Next slide. So as many of you are aware, our region is home to roughly 19 million people and about half the state's population, half the entire state's population, and that's almost about 13 million licensed drivers. Each year, on average, nearly 1,500 people die, 5,500 people are seriously injured, and 124,000 people sustain injuries in traffic collisions in our region. We anticipate that even as the region emerges from the pandemic, the rates of fatalities and serious injuries may continue to rise, particularly if people shift away from using public transit or shared vehicles. Collisions are occurring everywhere in the region, from Thousand Oaks and Ventura to El Centro and Imperial. However, the vast majority of these collisions demonstrate that more than 70% of fatal and serious injury collisions are occurring in urban areas, and almost 70% occur on local roads. Across the region, about a quarter of collisions are a result of unsafe speed. And this is important to note, as the survivability in a collision decreases significantly with increases to speed, as you can see in the graphic at the right. Next slide, please. This information and more detailed analysis is included in our Regional Transportation Safety Existing Conditions Report, which we'll link to in the chat. We've just completed an update of this report for 2020, and it does include some data for 2020, and it provides region-wide and county-level breakdowns for each of you. In our efforts to eliminate serious injuries and fatalities across the region, we engage in a variety of efforts as well, and these include the peer exchanges, which you're at right now, and our Go Human campaign, which I will outline for you in the next slides. Next slide, please. The Go Human campaign launched in 2015 to reduce traffic collisions and encourage people to walk and bike more. Now, since then, Go Human activities have expanded the conversation beyond vehicular violence into a suite of programs that mainly fall into these three categories. The first is co-branded safety messaging materials that can be requested right now on the Go Human website at no cost. They come in different forms, like the lawn signs that you see in the picture, banners, and bus shelter ads. Next, Go Human also provides a kit of parts at no cost. And the kit is a set of modular pieces that can be assembled to demonstrate different street design treatments like parklets, bulb outs, and crosswalks. The kit comes with marketing materials to show how typical streets can transform into one that centers pedestrians and bicyclist users, as you can see in the picture on the screen. And finally, there are safety workshops, webinars, and technical assistance. And an example of this is the Community Streets Mini Grants, which is a funding program meant to build street-level community resilience and increase the safety of people most harmed by collisions. Grant awardees will be announced this month, and activation should start this summer. In addition, there is a new Community Ambassadors Program, which is a participatory planning and leadership series taking place in the counties of Imperial, San Bernardino, and Ventura. Next slide. Excuse me. And of course, as I mentioned, you are all here today participating in the traffic safety peer exchanges, which are part of Go Human's ongoing efforts to increase traffic safety. You can visit the Go Human website at gohumansocal.org to register for more traffic safety peer exchanges and to learn more about the programs I just detailed. And obviously, you can keep up with the Go Human programs by signing up for the quarterly newsletter and following Go Human on social media at gohumansocal. Great. And so thank you very much for that presentation. I'm very excited to be able to present our first speaker. But before I did that, I also wanted to ask you all through a Zoom poll that is about to show up on the screen and ask, is public health a part of your agency's state goals, objectives, or strategies? And you can answer yes, no, and maybe. Great, and we'll give you a few more seconds. Well, I think it's pretty clear that public health is a part of many agencies' state goals, objectives, and strategies for the majority of people here, vast majority of people here. And so really looking forward to hearing from our first speaker, Miguel Angel Vasquez, AICP, who was one of the first planners hired in a public health department in the nation. His role at the Riverside University Health System Public Health is to strengthen the integration of planning and health through collaboration with non-traditional partners. Over the past 2 decades, he's provided professional planning and community development services to the private, the public, and military sectors. He received a bachelor's degree in urban studies and planning from Cal State Northridge and is a fellow of the California Leadership Academy for the Public's Health. Mr. Vasquez has won numerous awards and recognition for his work. So I'd like to welcome Miguel to speak today.
Thank you so much, Amy. Good morning, everybody. I first want to thank you for inviting me to be part of this conversation. And as soon as I get my slides on the screen, I can begin. Great. So the title of my presentation today, The New Normal Resolution, Confronting Systemic Racism and Inequities Through Prevention. I use this title because we are clearly emerging from COVID-19 pandemic, which has been very tasking in all of us collectively. And as we emerge, many things are different today than they were right before we entered into the pandemic. And one of those things is the conversation about systemic racism and inequities or equity that has bubbled up in our planning circles. So before I share the content of what I want to talk to you about, let me tell you a little bit about organization. Next slide, please. So I work for the Riverside University Health System Public Health. And essentially, we are the County Department of Public Health, and that is our brand. Next. The program under which I operate is the Injury Prevention Services, and this is our mission statement. We develop and implement strategies that will reduce the severity of injuries, disability, and death due to unintentional injuries to residents in Riverside County. Next slide. Under our program, we have two specific endeavors directed to working with transportation planners. One is our active transportation program, which you probably are aware of if you are from a county, or if you're a transportation planner, you know exactly what that is. Our target audiences are pre-K to high school students, college students, and the community at large. We intend to increase the proportion of students and families walking and biking to schools in area parks, increase physical activity and promote healthier lifestyles, increase park usage, build stronger communities, and lower rates of traffic injuries among targeted populations. Next slide. And the other program we have is our pedestrian bike safety, which is funded by the Office of Traffic Safety. And this program collaborates with local school districts, law enforcement, and senior centers to provide pedestrian and bicycle safety education in an effort to reduce pedestrian-related injuries and fatalities in children and adults. Next. So today, I'm not going to give you a very specific and detailed description of what we do, but rather I want to provide you with a framework that we use to be able to address the issues of the day. This framework, developed by the Bay Area Regional Health Inequities Initiative, is a tool that we use to gauge how we can actually, through prevention, address mortality, disease, and injury, and improve risk behaviors. As you will see in the center of this graphic, living conditions is really the realm of planners and transportation planners. We are the professionals that work on creating the physical environment comprised of land uses, transportation, housing, residential segregation or integration, exposure to toxins, and so on and so forth. One of the important things about this model is that in order for us to be able to improve living conditions and improve risk behaviors, decrease disease and injury, and hopefully alleviate early death or life expectancy, we need to look at institutional inequities. And to be able to do that, we need to find a way to have the hard conversations related to social inequities, which include class, race, ethnicity, immigration status, gender, and social orientation. Only by addressing these root causes of institutional inequities will truly help us to improve our living conditions and a more equitable development. All this work needs to be done in concert with strategic partnerships and advocacy, and we need to improve our community capacity building, organizing, and civic engagement. All this through a framework of policy. Next slide, please. So I wanted to show you a couple examples of tools that have been very useful for us. Number one, in 2011, our Board of Supervisors adopted this resolution called Healthy Riverside County. And I wanted to highlight one passage from it. And I'll read to you, be it further resolved that the Community Health Agency, that was our old name, work with other county departments and community partners to adopt preventive measures and develop initiatives and programs to fight obesity in chronic diseases and create and or work with existing conditions which further community health and wellness. Next slide, please. Now, this directive truly translated into direct and indirect policy efforts conducted by our 28 jurisdictions in the county in the forms of the creation of health initiatives, the adoption of healthy cities resolutions, or healthy eating, active living city resolutions, the adoption of health elements, and currently the preparation of environmental justice elements into general plans. Next slide, please. And more recently, our Board of Supervisors adopted this resolution in which our Board of Supervisors declare racism and inequity as a public health crisis. And again, I'm highlighting a couple of passages. Whereas systemic racism causes persistent racial discrimination in housing, education, employment, transportation, and criminal justice, in an emerging body of research demonstrates that racism is a social determinant of health and a significant barrier to achieving health equity. And then here is a couple pieces from the actual resolution. The Board of Supervisors are asking the county departments and agencies to identify and implement solutions to eliminate systemic inequity in all external services provided by the county, including but not limited to the following sectors: health, social services, housing, homelessness, and workforce, business and community, public works, land use and environment, finance and government, and public safety. Next slide, please. And you are probably aware that there is a resolution, a very similar resolution that was adopted by SCAG, in which SCAG states their conviction that systemic racism is a human right in public health crisis, which results in disparities in family stability, health and mental wellness, education, employment, environmental justice, economic development, transportation, public safety, incarceration, and housing, in reaffirming its commitment to advancing justice, equity, diversity, and inclusion in Southern California. Now, what does this mean? This means that we are moving into a direction in which we, as professionals in planning and public health, we're going to have to set some time aside to be able to learn about the meaning of these resolutions, and also how to actually be agents of change to be able to respond to the people in leadership roles that we have elected to lead our communities. How are we going to be a part of that? We're going to also take time to build empathy for our communities, especially for those communities or members in our communities that are experiencing a greater burden, in this case, of unsafe roads, unsafe traffic conditions, of unsafe streets. So there's going to be quite a bit of work ahead of us. And these resolutions are truly the beginning to be able to take action. So my question to you, next slide, please, is what sort of tools do you have at your disposal, similar to these resolutions, at the place where you work, that will enable you to be able to have a conversation about it? What are the tools that you may have? Perhaps you already have policies in place or programs that actually will help us to implement approaches that will help us become a more equitable and just practice and profession. And with that, thank you so much. I'm going to turn it back over to our facilitator.
Thank you so much, Miguel. And thank you for naming the specific work that jurisdictions have now been doing in framing racism as a public health emergency. So thank you so much. I'm going to activate the next poll now, and that's asking, are you partnered with a public health agency or organization in your work? And you should see it on your screen. Great. I think I'll give it a few more seconds to allow people to answer. And it looks like for a majority of you, many of you are partnered with a public health agency or organization, which is great to hear. And I think we'll make it relevant for our next speaker, Alexis Lance. So I'm really excited to introduce Alexis, who is a mom and a senior policy strategist with the PLACE program at the Los Angeles County Department of Public Health. In her role at PLACE, she has assisted cities and the county with active transportation planning, policy development, and funding. And she launched the development of the county's first pedestrian plan, Step by Step LA County Pedestrians Plan for Unincorporated Communities, and helps facilitate the County of LA's Vision Zero initiative. Previously, she was the planning and policy director at the LA County Bicycle Coalition, and Alexis holds an MA in urban planning from UCLA. So welcome, Alexis.
Great, thank you so much, Amy, and hello to all of you on this training. As Amy mentioned, I'm an urban planner at Public Health, and I'm going to be talking about some of our traffic safety efforts that we're doing with the city and the county of Los Angeles. Next slide. So much, even the next slide. Sorry. All right, so much like Miguel, I'm just going to provide a little bit of background on where I work. The program I work for is called PLACE, which is within the Division of Chronic Disease and Injury Prevention. PLACE stands for Policies for Livable, Active Communities Environments. So we focus in on built environment policy and planning, primarily working around active transportation, urban forestry, and have also been involved in some park and affordable housing efforts. And we've done this through different approaches since the founding of the program in 2006. We've been doing it in the past through providing grants to jurisdictions and community partners, providing direct technical assistance to cities to develop active transportation plans or park plans, and then collaborating with county departments, as well as other jurisdictions within LA County and agencies, and of course, community partners as well. So over the years, changes in funding have meant changes in the way our work works, the types of projects that we work on. But collaboration remains a consistent approach to all of our efforts. In public health, in the public health field, and I know some of you are coming from the public health field on this call, this is sometimes referred to as the chief health strategist approach, meaning working with all relevant partners so that they can help drive initiatives, including those that can explicitly address upstream social determinants of health. So we acknowledge as public health that we really need to be working with our partners who have more control over the built environment or education policy or other things to help change the outcomes in terms of people's health. So next slide. I'll preface my talk today by sharing that due to the pandemic, our efforts to work on Vision Zero have been greatly curtailed over the last year. So as things start to stabilize, we're hoping to pick back up a lot of this work as we transition to a new normal. But myself and the director of the PLACE program, who have been the primary staff at Public Health, although we have many people doing things that intersect with Vision Zero, But we've been sort of the backbone folks. We're still assigned to pandemic response duties and likely will be through the end of this year. So our work has sort of slowed down. So I apologize that some of this is a little dated. So that said, traffic fatalities and severe injuries are a serious health threat in LA County. As Amy pointed out, in the SCAG region, this is an issue region-wide. And in LA County, motor vehicle collisions are the leading cause of death for children aged 5 to 14, and the third leading cause of premature death overall. That data is a little old and is not accounting for COVID-19. But prior to the pandemic, that's what we were seeing. And much like Riverside, the LA County Board of Supervisors adopted a motion in July of 2020 declaring racism a matter of public health in Los Angeles County and establishing an anti-racist policy agenda and requiring department directors to start looking at and working on policies and procedures that may impact discrepancies. So I'm going to provide some examples of some of our collaborative efforts to eliminate traffic-related fatalities and severe injuries and address systemic inequalities within the city and the county of Los Angeles. So just a little background here. As the Department of Public Health, we serve many jurisdictions in LA County, with the exception of Long Beach and Pasadena. So we are the health department for everybody else. At the county level, we are co-leading the county's Vision Zero initiative with LA County Public Works, playing a role of the backbone agency, helping to convene county departments, the California Highway Patrol, who does traffic enforcement in the unincorporated areas of LA County, which is what the county's Vision Zero plan is focused on, the unincorporated communities. And we are responsible for leading a number of actions in the county's Vision Zero action plan. With the city of Los Angeles, we're a partner at the table. And in the past, we've been able to provide funding to support staff to do data analysis, which I'm going to touch on today. And we're a partner listed on some of the actions, but we're not a lead agency on the city's Vision Zero initiative. And I know I may have some county and city colleagues on the call, so please feel free to chime in, during the discussion and Q&A today with your perspectives and to highlight your work. So as I know, probably all of you are very aware, a key element of Vision Zero is taking a data-driven approach. And public health agencies can be partners on accessing and analyzing data to better understand the full impact of traffic collisions on different populations. We can also be partners on public education efforts to foster culture change. And I'm going to highlight some of these efforts today and some of the policy work that we're undertaking as part of these Vision Zero initiatives. Next slide. So these are a little hard to see, but as part of our collaborative efforts with the city of Los Angeles, we were able to use some CDC prevention dollars that were focused on diabetes to focus in on walkability and issues that hinder walkability, especially in areas where we have high rates of diabetes and other chronic diseases. This enabled us to bring on staff to both public health and LAUT and focus in on doing some data analysis around both traffic collisions and then bringing in some other health data. One of the things we did, which I'm sharing here, is a story map to highlight different data sources and how they can overlap to tell a story. So on the, I'm going to get this, the red line side, the left-hand side, my left, is the city's high injury network. And the map on the right, on my right, as I look at it, is this a map using data that comes from the LA County Health Survey, showing the percentage of people in each community plan area who feel it's safe to walk or use parks in their neighborhood. So areas that are lighter show that people there felt their community was less safe to walk. So you can kind of see the overlap there between where the density of the high injury network is with where folks feel more unsafe to walk in their community. So some of the barriers to walking are obviously physical, lack of sidewalks or safe crossing, high-speed roads, and some are also social, such as concerns about safety. And this there's more to the story map, also going into issues around safety as well. But by bringing in some different health data, we can try to better understand perspectives and who's being impacted by traffic collisions. So I'm going to drop just the story map link in the chat real quick, in case anyone wants to go. And then we can go down to the next slide. So another thing that we did with the when we were working with the city of Los Angeles was look at EMS data. So traditionally in Vision Zero, or with many traffic safety initiatives, we're looking at local law enforcement data to analyze outcomes from crashes. However, medical data available through local hospitals and emergency responders can offer a more granular view of how motor vehicle crashes and the outcomes for the victims. And I'll drop the link to this brief in here because it does go into outcomes based on speed, but I'm not going to touch on that. So a few years ago, we were able to use EMS agency trauma data to describe the injury burden and relationship between vehicle speeds and injury outcomes for pedestrians in traffic collisions. And this analysis showed us that Black or African-American pedestrians are overrepresented among pedestrian crash victims based on the trauma data that we have. I think this starts to point at, a lot of the same areas that we're seeing in the high injury network are also communities where there may be higher residents who are African-American or Black. Where we see a lot of, it all starts to overlap between poverty levels, housing issues, whatnot, but we start to see these trends with the data. Next slide. So this was some data that came out from our Public Health Center for Health Impact Evaluation. They were tasked with looking at mortality among people experiencing homelessness and developed their first comprehensive report in 2019. A follow-up was recently released in January of 2020. And this research found that people experiencing homelessness are also at increased risk of transportation-related fatalities. And that the overall mortality rate up until 2019 had been increasing, and it had, I think, increased by about 60% between 2014 and 2018. And overall, the overall mortality for people experiencing homelessness had been increasing, which means that the increases in number of deaths can't solely be attributed to the fact that the numbers of homeless people have increased. Being homeless has become more deadly in Los Angeles County. So for the combined years of 2017 and 2019, this research showed that people experiencing homelessness are 17 times more likely to die from transportation-related injuries than people in the general population. And the unsheltered status of our LA County homeless population vastly increases their exposure to traffic hazards. Many of these people are people walking as well as people bicycling, and they live on the streets, so they're exposed all of the time. This was an issue we were beginning to work on with the city of Los Angeles before the pandemic, and efforts to increase shelter and housing are likely going to decrease our traffic-related injuries and deaths within the homeless population and overall. So if we can, that's another reason, and from a cross-sector standpoint, that addressing homelessness and providing housing is important to our traffic safety initiatives. Next slide. So a guiding principle for the county's Vision Zero action plan is health equity and addressing practices that disadvantage some populations over others that lead to health inequities. Addressing systemic racism, I think, as we all are aware, it means looking at and addressing policies that can place an undue burden on our communities of color and low-income people. And in many cases can create more interactions with law enforcement, which we know can have devastating outcomes, as well as financial penalties. So one of the things we included in the county's Vision Zero action plan was to re-examine a policy in the county's municipal code that currently prohibits cycling on the sidewalk. I think many people in the transportation profession, understand that there's a lot of conflicts that come from cycling on the sidewalk. But it is a place where people oftentimes feel safest. And so while Public Works is actively building a comprehensive bike network, the reality is that many people bicycle on the sidewalk because they don't feel safe in the street, even when there's bike lanes. So how can we look at this policy and understand how it's impacting people? Next slide. So we started this effort by looking at, where are bicycle citations happening? And we were able to get data from the Sheriff's Department. And just briefly here, you can see where the poverty rate is compared with where bicycle citations are being issued. And there's a hefty overlap there. And so I think my time's probably going quickly, but I just wanted to highlight this because part of it for us is better understanding where, what data we have and where things are happening. And so we were able to work with a graduate student from UCLA to examine this data, to look at poverty levels and racial information to better understand who's being ticketed for walking and biking citations. Next slide. So before I end, I just kind of want to briefly touch on the importance of creative collaborations as well, and moving beyond just the typical engineering and law enforcement collaborations that I think have been traditional with Vision Zero, and looking at creative collaborations. So we were able to work with our Department of Arts and Culture to have an artist in residence within the PLACE program to help us with culture change and looking at how can we create more empathy for people walking and bicycling, especially the youth and the elderly. So we worked with an artist in residence, and he worked with youth in the community of Westmont, West Athens, where there's a number of collision concentration corridors, and worked with youth to develop this traffic safety campaign that you can see here, which ran in the fall of 2020. Next slide. So finally, I'll just end by saying that, changing our culture to prioritize traffic safety takes a multi-pronged approach, which I think we're all aware of. And traffic safety media and education campaigns are part of that, which is something public health has traditionally done. But the policy systems, environmental changes are what's really going to enable us to make progress. And we know that widespread culture change is possible because it's happened before. We did it with tobacco. And that took a lot of policy change to limit where you can smoke, to make smoking more expensive, and also pairing it with communications and education campaigns to change the norm and create widespread widespread support for not smoking. So I'm gonna just end there. I'm sure I've gone over my 10 minutes.
Thanks so much, Alexis. I really appreciate that. And thank you so much for the presentation. I'm really excited to introduce our last speaker today, Dr. Susie Lopez Guerra, Director of Community Relations for the Santa Ana Unified School District. And so Dr. Lopez Guerra is currently the Director of Community Relations for Santa Ana Unified School District, like I mentioned, where she's developed a comprehensive network of partnerships with stakeholders throughout the county. She collaborates with local businesses, community organizations, parent groups, other USD departments and school sites to establish and leverage mutually beneficial relationships. Dr. Lopez Guerra joined Santa Ana Unified School District in 1999 as a first grade bilingual education teacher. During her tenure, she has served the community as a teacher, mentor, community technology liaison, curriculum writer, and certificated learning and achievement specialist. She earned her bachelor's degree from UC Riverside, master's degree from Cal State Fullerton, and doctorate degree from the University of Southern California in teacher education and multicultural societies. Thank you and welcome.
Thank you very much for having me and giving us this opportunity to collaborate and learn from one another. So I am going to continue building on the conversations that my colleagues have started in regards to providing equity of access, but my lens is that through partnerships in an educational setting. So Amy, will you please click on the presentation? The next slide. Thank you. The next one, please. Just at a glance, who we are at SAUSD, and I know this data is over a year old, but bear with me, COVID has had an impact on all of us. Santa Ana Unified is the second largest district in Orange County and the 7th largest in the state. Up to about 10 years ago, we were the first point of entry for all students coming in from Latin America. And that gave us the privilege and opportunity to engage in ways that were able to address a lot of the language concerns and needs that our families had, and therefore creating a very strong multicultural, multilingual educational system. Next one, please. So part of this concept of engagement and communication to mitigate the inequities that we've seen have been through the local accountability plan. And it is part of our goal as we talk about policies that support the practices. At the district, it is our goal 2 out of 4, and it's to establish collaboration and communication across all levels of the district for staff, students, families, and communities, and that has been integral. Right now, we are part of the National Center on Education and Economy, where we're engaging with community, all our stakeholders, community members, families, staff, to develop graduate profiles, teacher profiles, student profiles, every kind of profile that can allow us to ensure that we're speaking the same language and partnering with one another in support and benefit of our students and ultimately our community. We're also part of the California Collaborative for Educational Excellence, in which we are the second cohort for community engagement. The next one, please. I wanted to bring this forward because as we talk about addressing inequities and bringing the social justice lens to the way in which we partner and authentically engage with all stakeholders, we've started the practice of family and community engagement about 3 years ago earnestly as a district. And this is one of those times where we had to sit back and understand and acknowledge the attributes and assets that our families bring in the development and support of our students. So this is our guiding force. It's this full, equal, and equitable partnership among everyone, right? Family, students, teachers, community members. And as we talk about the social determinants of health, the conditions for learning, this has been the foundation by which we have continued to support and partner to address those things. The next one, please. This is, as my husband likes to call, this is edu-speak, but as in education, we often like to focus on blooms, right? That cognitive development, that cognitive and critical engagement. But as we really understand our community and allow ourselves to meet our students and our families where they are and really align the resources to ensure that we reach our academic and social emotional potential, we had to take a step back and look at a Maslowian approach. Are the psychological safety needs of our students being met so that then they can reach their self-actualization? And part of what we've been doing is through the partnerships that I'll be mentioning in a little bit, we've been able to collaborate and partner with different organizations so that our students and our families are thriving within and throughout the community and above and beyond the K-12 institution that I currently serve. Next one, please. So these are some of our partnerships, not all of them. And part of what I want to focus on, it does take a village. So as we're talking about safety, traffic control, as we're talking about addressing the social emotional needs that we are going to be facing or addressing after this 1.5 years of COVID, these are some of the organizations who we gladly call partners. We are currently part of a CalOptima grant on the social determinants of health. We partner with our higher ed institutions, with our businesses, and with different nonprofit resources that provide parenting, fostering, food, that address the housing inequities, the food deserts, that provide equity of access at every level to our students, our families, and anyone really in the community. Next one, please. The work that we are doing here is very much working along with our families. As we're talking about this equity lens, we are no longer, and not that we were before, I should really be careful with the word, but we are focusing on this asset-based approach of working with families and honoring and valuing their contributions. So as we address not only what's happening within the K-12 institution, we're also addressing what's going outside so that we develop this advocacy component through a social justice lens and a positive or an asset-based lens, bringing forth their funds of knowledge, their values, and their cultural contributions. Next one, please. These are some of the ways in which we engage with families, and it's not just through SAUSD, but it's in partnership with the different organizations. But at the base of everything, and to heighten the sense of value and relationships, the engagement that we partake in is these different multicultural, multilinguistic, interest-based opportunities. So during COVID, when we went completely remote, we did a lot of virtual supports, coffee with different staff. We have a 1-to-1 ratio at every one of our schools with a family and community engagement liaison who engages with families to connect them with the school and all the resources, academic and otherwise, to support students through their journey at SAUSD. The next one, please. This is another list of things that have happened, the digital access and literacy that have provided our families and our students the opportunity to continue learning and to continue this asset-based lens as they engage in their students' journey. I have to stop here and say that these resources and this support is not limited only to students, and it's not only provided by SAUSD. We engaged with some of the partners that I mentioned earlier, but this is open to anyone in the community who is interested in partaking in any of these opportunities. The next one, please. Here's another example of the variety of offerings that we have continued to have in this remote life that we have had for the last year and a half. We're really excited for August 16, which is when we go back to in person. But this is, again, how do we provide equity of access in a multitude of areas to all families and the community at large as they have been faced with challenges never before brought forth. The next one, please. This is part of the research the outreach that we have done. Part of eliminating the barriers, part of providing that equity of access so that we are addressing concerns, whether, again, those that go above and beyond the K-12 system and go into the activism or the city concerns or the community concerns as we were faced with during COVID, as mentioned before, the food insecurities, the health insecurities, the housing insecurities, the employment insecurities. We provided a variety of platforms by which we were able to communicate and engage with families in the way that they felt most comfortable. And so this happened through in-person lines, Facebook, Parent Square, which is a very targeted approach to disseminate information, social media. And then we went ahead and vetted and provided additional resources and supports so that families were using trusted partners in addressing their needs. The next one, please. This is just an example of the outreach and communications that we were able to have with our families in just the month of April. You can see that although we have 48,000 students, we were able to make 11,000 contacts and had over 5,000 attendees in our workshops. The next one, please. Will you go to the next one, please? And that is it for me. I want to make sure that I focus on any of this information is accessible to all of you. Our focus through the partnerships that we currently have and any that we have with anyone is learning from one another, raising the bar, ensuring that we create an ecosystem of support that values the contributions that our families and students have and that raises their voice to the forefront. Thank you. Thank you so much, Amy.
Thank you so much. And I got to give credit to my colleague, Jennifer, who was the one who was actually moving the slides forward. So thanks, Jennifer. Yeah. And thank you so much for presenting on that, Susie. And for all of our speakers today, I would love to ask just one question to all three of you in our little fishbowl right now. And I want to ask, how have the intersections between public health and traffic safety changed during and after 2020, considering the COVID-19 pandemic, the racial justice uprisings that took place during the summer?
If I may, through one of the communities that was probably the hardest hit in Orange County, we had the chasm, right? We had places in Orange County where COVID was perceivably unscathed into the community, and Santa Ana, Anaheim, and Garden Grove were some of the hardest hit. So for us, it was very much shifting from this, as I mentioned earlier, this cognitive focus on education and really bringing it back to these basic needs and identifying and seeking and making sure that we were vetting those resources, Amy, because part of the issues that we were having, we had to turn into a public safety and service system rather than an educationally primarily focused, because we needed to address those basic needs before we were able to address those cognitive and academic needs.
I think that's very similar in Los Angeles County too. We've just begun doing some pedestrian planning in some of our unincorporated communities like East Los Angeles, Florence, Firestone, Willowbrook, that are some of the hardest hit communities from the pandemic. And so right now, even though we're getting started on some level of community engagement, we're also trying to come to the community with resources to address more immediate and pressing needs. We know folks still have, are suffering from job loss, or are concerned about their housing. Many are essential workers and maybe are not vaccinated yet. So how do we make sure that they've got the right PPE if their employers are not providing it to them? So really trying to come first with what are the resources folks need that are pressing, and then getting into conversations around traffic safety and whatnot after helping with those first things.
On our end, I don't have any numbers right now to, I guess, tell you the story, but certainly COVID-19, as others have mentioned, sort of shifted our priorities. We were and still are the primary, I would say, agency in charge of making sure that we come out of the pandemic as a public health department, and or active transportation program team, they have still able to continue to work on our ATP grants with different modifications. And I don't know what sort of traffic counts or data they have collected since the pandemic began to be able to tell you the story, but looking at that aspect of who gets impacted by all these maladies, not only as a result of COVID-19, but as a result of structural inequities, we see that our communities of color are the ones that still are getting the brunt of the impacts. So I don't think things change much, other than perhaps really people didn't move as much as they did before, because we had the stay at home orders and people working remotely. But some of our communities, like our farm workers, they didn't have the luxury. So it would be good to see to do a study on what the impact on traffic safety was for that particular community, to see if there were any changes.
Thank you so much. And we have a question right now in the chat from an audience member, and that is, when pushing for active transportation projects, is safety or active lifestyle or exercise a more compelling public health message? And that can be for anybody.
So the options were what?
It was safety.
Safety.
It was a safety or active lifestyle, exercise.
Active lifestyle.
Mm-hmm.
Well, those three are compelling. Certainly anything related to public health is compelling, because at the end of the day, our goal is to be able to save lives. We want people to live longer, a healthy life, obviously. And if you get injured by a traffic incident, you may live longer, but you may live with pain and you may become disabled. So all of those pieces are important in making a case for traffic safety, because that is just one piece to be able to provide at the individual level a full sense of, I guess, opportunity to have a healthy life. So that's my answer to that.
I'd add, for some of our work, safety is very compelling with community members, especially when it becomes relative to like their specific street or the streets in their neighborhood. I think people prioritize improving the safety of their neighborhood streets in order to make it better for their livelihood, for their children to be able to take advantage of walking to school or getting to the park or whatnot, so that safety concern, and people come to so many community meetings with concerns about speeding and other issues. And so, helping people understand the toolbox that can help them address safety, and then thinking bigger beyond their neighborhood of how do we address safety overall? Because sometimes people really care about their street, but then they're like, I need to get across town and it's got to be fast. So how do you, help tie that all together?
Susie, would love to hear your answer to that question too, in the context maybe of like projects that are taking place. Like, what is the best narrative for communicating these like safety narratives and projects to, I think, families and the students that you might be working with?
So for us, it has been engaging in different types of partnerships, right? So for the safety, we've been partnering with the local police department and our school police department just to provide safety and forums for families to gain understanding, because I'm not familiar with LA, and I apologize for that, but Santa Ana is it's a very small and dense community. So we have a lot of concerns regarding safety and equity, and what sides of town get the resources and what sides of the town don't, right? So for us, it has been engaging not only with our local elected officials at a Congress level, senator level, and assemblymen, as well as our city mayor, but also engaging with the different, policing departments, right? Whether it be CHP, who comes out, the city's urban planning, who comes out and provides forums and conversations. And during COVID, the in-person that was happening before is not as likely happening, but we're hoping that these forums and these bike safety and cross safety and walkability tours continue. But during COVID, it was very much sitting back, and COVID took a forefront. I have to tell you, during this last year and a half, it hasn't been so much that. It has been the insecurities that my colleagues here have talked about, the housing, the job, and the food insecurities, as well as the health insecurities that we're currently seeing. Because for me, and I don't know if this is for Miguel and Alexis, but COVID brought forth and heightened the inequities that were already at the forefront. That's what it did, especially for underrepresented communities such as ours.
Mm-hmm. Absolutely. Well, I appreciate all the time for the conversations that we had today in response to the questions, and particularly around, like you were saying, Susie, like the COVID-19 question, because it really has highlighted all the disparities. And now I wanted to turn it over to Clay to get us sorted on the breakout rooms that we're about to have.
Yes, thank you, Amy, and thank you to our speakers. This has been a really great discussion. So now we're going to get into some breakout session discussion. And the purpose of these breakout sessions is, one, to learn ways to think about and implement the intersections of public health and transportation safety at a practical level. And the purpose is, how can you apply this information to your community? And we already saw a few questions in the chat, and we are going to randomly assign people to a group using Zoom. There will be 2 breakout groups. We're going to meet for about 12 minutes. Each group will have a facilitator and a note taker. And then we're going to report back on what we talked about. We want this to be a safe environment for different types of sharing. Um, so you may want to put your comments in the chat. We might call on you to kind of clarify or explain more, or we'll do raise hands and speak. But here are some of the questions that we're going to be talking about. What did you hear today that made you think weaving public health and traffic safety would work? How could it be improved? What are some of the obstacles in bringing the two closer together? Have you seen these in your jurisdictions? What are some projects you would like to see but in motion from your work? And then this just in the chat, what are the best mechanisms for holding departments of transportation accountable to public health objectives when they are budgeting for projects or developing criteria for project selection? I threw that in right at the end there. It's a great question that came in. So here are some links. But with that, we're going to go ahead and get started in our breakout sessions and have that discussion. Thanks, everybody. Should see those. I just got my invitation. I hope you got yours. And we have been beamed.
Okay.
Thank you so much, Dr. Rodriguez.
Okay.
Hello, everyone. Do we have everybody back? Are we all back? Okay, great. I think, Amy, you're going to share your screen with the Jamboard. And while you're doing that, I can actually put it in the chat. Okay, so we're going to report out on the on what we discussed today, and we're going to be using Jamboard. And so I can find my chat. There it goes. Things have jumped around a little bit here. Here we go. So here's the link, and if you click on that, you should be able to, you know, as people are commenting about what we talked about, if you have some other thoughts or you want to chime in, clarify, you can just click on the side and create a sticky note and write something in there, and then I think you just save it, and it'll appear on the board there. Yeah, and so with that, we're gonna go ahead and start with breakout room 1 on what was discussed in breakout room 1. Actually, I don't remember. Was that my breakout room? Okay, I see Amy nodding. Okay. So in breakout room 1, does anybody want to, we didn't choose a person, does anybody want to sort of report out what we discussed? And if not, I'm happy to do it. I'm not seeing anybody jump in here. Okay, I'll do it. So when we talked about question 1, you know, what did we hear today that made us think about public health and traffic safety, how they could work together, what could be improved? Maria works in Oregon and talked about the lack of accountability. You know, Maria is the one who put in the chat the question about budgets. Often feeling that public health is a talking point or a business case, but not having that strong budget line item. But did talk about Oregon passed the bike bill, sort of historic bike bill, 1% in active transportation investment, but that was many years ago. And so thinking about what that would look like, you know, today. Miguel also discussed, you know, some of the issues around inequities and how this exacerbates the outcomes for public health and traffic safety. You know, really loved Alexis's session that showed the data in support of, you know, where these overlaps are. So I would say that that's our report for question 1. For question 2, and anybody can go ahead and post something on these in the Jamboard as well. For question 2, Sonia Sanita from Ontario talked about, you know, what are some of the obstacles in bringing the two closer together? What have you seen? We have an international group talking about police and public health and how police being part of, you know, the conversation in terms of public health rather than this sort of emphasis on enforcement. Also looking at academic partnerships, moving more toward a Vision Zero train of thought. And then for question 3, what are some projects you would like to see put in motion? Dr. Paul Rodriguez really loved what SCAG is doing with COVID. We're seeing huge changes, and we need to be cognizant of what those changes are going to really look like in the future and the impacts of those changes going forward. And SCAG is a good place to sort of start that conversation. I'm very glad to be here and is going to attend another webinar. So that's group 1.
Great. So we were breakout room 2. And I was wondering if there's anybody who spoke or said anything who would like to contribute some of their thoughts to the first question. I did take a few notes, but would love to hear directly from folks who are in the room themselves.
Most of us are behind the FBI finishing their job, 450 arrests, and if the biggest investigating body in this country can't put
Well, there were definitely a lot of conversations around, I think, the differences and the considerations that need to be made around engineering, but then also behavior changes. Like what actually, I think it was Mike who said something about how do we make sure it's not always seen as engineering your way out of something that's just behavior? So, and then it turned into a really great conversation around language and the necessity of, I think, making sure everyone had the same vision and the same intentions in terms of like the projects that were being worked on and ensuring that everybody was on the same page. And then for the second question, I'm finding it a little bit hard right now to multitask. So if someone else wanted to add some sticky notes while I was speaking, would be super great. That second question around the obstacles that we were seeing, you know, and whether that has been seen before. I think there were some conversations around, you know, political priorities and just politics in general, and just being really difficult in terms of using these, bringing the two of these fields closer. And I think that was also when we got to question 3 in terms of imagining what types of projects that we would like to see put into motion. There was a mention made by Alexis about protected bike lanes, but obviously it's difficult with the politics sometimes in like a specific jurisdiction. So that was something that was mentioned as well. But would love to hear from other people in that room if there are things that resonated about what we were talking about, or if there were kind of like wisdom or other thoughts that came up after a conversation or while we're kind of going through all this right now. Would really appreciate any of that. Sorry, Dr. Rodriguez, I'm not sure if you're like speaking. It seems that we can't hear you.
I'm speaking into my mic. Let me see if I.
Okay. Okay, now we can hear you now. We can hear you now. Yeah.
I think when you speak about transportation safety and so forth, what National Corps is doing, and Comey, the executive director from SCAG, is involved. So is Roland, and other techies are involved with helping National Corps. And what it is that broadband for all of California. They have already written a draft to submit to the federal government to get funding. The state of California, Governor Newsom has already pledged $4 billion, and we're going to be asking the same amount from the Fed. So by having broadband included into the conversation of transportation safety, it's important because information can be transmitted instantly to all parts of California, rural and so forth. So we're hoping that this will pass. Listening today to the infrastructure on, I'll say it, MSNBC, not the other station, they're saying that it possibly could be passing. So I think we should keep an eye on that and really help and participate in getting the broadband for Wi-Fi for traffic safety, transportation. That will be included, I think, in that important connection. So that's what I'd like to say. And I have to leave probably in about 5 minutes. So anyone that will want to have the link, it's bi-weekly meetings. I put my email address on the chat, and I can just give it to you. It's very simple, PAR913@me.com. and I'll send you to the digital divide. Okay, so that's about it.
Thank you, Dr. Rodriguez. Any last minute thoughts before we move into the conclusion here, Amy? All right.
Great. Yeah.
Okay.
Maybe. Oh,
Am
then
I sharing my screen now, or
I'll
are
stop.
you?
I'll stop sharing my screen.
Okay.
Yeah. And then excellent. Yeah, thank you so much. So thank you all so much for participating in SCAG's Traffic Safety Peer Exchange today. And as we mentioned at the outset, presentations are going to be mailed to everybody who registered. So if you haven't registered yet, you can register and hopefully you'll still get a chance to access the recording from today. And later this month, we'll be posting all the recordings from all of our sessions on the Go Human website. So we'd also encourage you to consider participating in another peer exchange, as we'll be holding one a week until about mid-August. And we'd also like you to share your feedback with us through an evaluation survey. And we will be posting links in the chat. So if you have any questions or any follow-up questions, please feel free to reach out to me or I said the manager for the program, Courtney Aguirre, whose email was at the beginning of the presentation, and we can also drop it in again. And thank you again for attending. Thank you so much to our speakers. Our speakers, Miguel, Dr. Gary Lopez, and also Alexis today. So much appreciated. And thank you all for joining us. I hope that you stay safe and healthy.
Thank you.
Thank you, Amy.
Thanks.
Everybody.
Thank you, everyone. Have a wonderful day.
Everyone.
Bye.
Thank you. Nice to see you all.
I think we're good to just close the room. Great. Thank you.